So as we start moving from N of 1 analysis, which means reviewing the data from client to client, we also need the tools to be able to review data across cohorts of users. And the tool we use at Heads Up for cohort analysis is called Signals. Signals lets us look at all of our Oura users on a single screen. Or maybe we want to even have subcategories of users. We can actually create subcohorts. Maybe we have a subcohort for all of our clients or patients who are recreational athletes. Or we have a subcohort for individuals with a specific medical condition. So we can slice and dice the users however we want. All you do is you just tag those users, and we can analyze based on tag. So let's look at two examples of cohort analysis. First will be the Oura AM Readiness score. And then the second one will be looking at HRV. So let's say I want to look at everyone in the practice, and I want to look at their AM Readiness on a single screen. So first of all, you can collapse these menus. That'll give us a full screen view. So instead of looking at one individual, now we're looking at everybody. I can see the AM Readiness across the whole practice. I can see the most recent result for each individual, the last 3 days, the last 30 days. And then down here, we can get much more detailed. This is going to start letting us really drill into the cohort. And I can see the average score for each client on a single report. And maybe I want to sort the average AM Readiness score for each client. Maybe I want to look at how often they're wearing the ring. That's a very common use case. Are these clients even compliant? Are they wearing the ring? So you'll see within the last quarter, I can look at how many readings and make sure they're wearing the ring. Maybe I want to look at their 90-day baseline. This will give me their 90-day baseline. And perhaps the most important number is are they improving? And that's the deviation from baseline. And you can see this person has improved 5.9% this quarter relative to last quarter. And this person is down 3%. So this is just one example of a cohort report. We can customize this to your own practice so that you have the exact answers you need right at your fingertips. So if this report isn't the way you want it, we can customize it. Let's look at one more example of cohort analysis. I'm going to click back into the menu. Let's say I want to look at the heart rate variability from the Oura Ring for everyone in the practice. I'm going to look at the HRV leaderboard. And similarly, we'll have the average for the team. We'll have the most recent values. We'll have the last 3 days. We'll have the last 30 days. We'll have the average HRV for each client. Again, we can quickly sort from lowest to highest or from highest to lowest. We've got their maximum value, their min value. I'm looking at the last quarter. You can change it to any period you want. And then I can look at their improvement from baseline. I can look at how many times they're wearing the ring. So what Signals allows us to do is start to move into cohort analysis. And when you've got multiple clients following a program or a protocol, this lets you see all the outcomes on one screen. So we provide some out-of-the-box Signals reports, but more commonly, when we set up your account, we're going to build the Signals reports and customize them so you can track the outcomes exactly the way you want. But more important, the cohort analysis tool is called Signals, and that's how we help you move from an N of 1 analysis to an N of many analysis. Thanks.